From CBS4, this is Aging Independently with Christine Bartel, empowering seniors to live on their own terms in their own homes. Sponsored by Amedisys Home Healthcare, caring for your loved ones as we would our own.
Hi everybody, and welcome to our show. With 10,000 baby boomers turning 65 every day, our population is obviously aging, and our care needs and costs are soaring. Thankfully, more and more healthcare is moving into the home, helping people stay independent and lessening the financial burden.
My dad died 5 years ago, and Mom stayed living here and did as well as she could on her own until the situation made it be where she couldn't live independently anymore. She needed 24-hour care, and we looked many places and avenues to find that 24-hour care, and we finally did. This is our nursing home now.
We're seeing people in homes, in their own homes now, who 20 years ago would not have been able to have been there because they didn't have all the services. But now, as the various agencies, the various types of services, including the providers, have evolved to take the services to the home, we're seeing more people who are more frail, more sick, staying at home, and the services come to them. There is a cost, I mean, to get folks out taking care of people in home. There's no question about it. But it will turn out to be, and has been shown to be, much more cost effective than the traditional model we've seen over the last 20 years.
Dr. Kevin Henning is the Chief Medical Director with Amedisys Home Healthcare. Thank you for being here, Doctor.
Thank you. I'm glad to be here.
Let's talk about these rising healthcare costs. What's happening?
Indeed, it's of course a huge problem in our society right now. Healthcare expenditures are rising much faster than the rate of inflation. The proportion of our entire economy that's spent on healthcare is rising every year. Past 15%, approaching 20% of all of our economy is spent on healthcare. It's a huge burden on our country.
How can seniors and caregivers help with this?
What they can do is start asking for care to be provided at home. A survey by the AARP found that 87% of all folks over 65 would rather be cared for at home. That's where people want to be. It's safe, it's where their loved ones are. If we can provide more health care at home, we can save tremendous costs and give people what they want, high quality care in their home.
Well, and it's funny, people don't realize that this care is available at home.
Indeed, it's not well known that there is the benefit of home health care at home that's provided by Medicare. This is appropriate for patients who've left the hospital and want to continue their care at home. To be eligible for care at home under the home health care benefit, you need to have a skilled nursing need or a physical therapy or occupational therapy need. You need to be homebound, which doesn't mean you can never leave the home. It just means there needs to be a considerable effort to leave the home to get to your doctor, and need to be under the care of a physician. So many people are eligible for this care. It's what people want. It provides high quality care, and it can reduce our costs.
And we have a lot of people that say, oh, no, I don't need that, I don't need that, and the doctor has recommended it. We need people to wake up and say, if my doctor's recommended home health care post-discharge from surgery or something, by all means, accept it. It'll help you get back to a baseline.
Absolutely. Home health care in the home allows you to get to your hospital function. It allows you to recover from your illness. It increases the odds of you not having to go back to the hospital.
So it's important that they accept this care in home.
Right. You know, again, people want to stay at home. Very few people want to be in the hospital. Receiving home health care can allow you to stay at home, improve your outcomes, and reduce re-hospitalization rates.
Great, Doctor. Thank you so much for being here.
My pleasure. Thank you.
For more information on your home health care options, call the Amedisys information line at 1-877-877-8145. You can always go to our website for more information, to take today's poll question, and learn more about aging independently by watching all of our shows. Just head to cbsdenver.com and click on Aging Independently. Be sure to join us next time for more information on staying independent in your home.
Thank you for watching Aging Independently with Christine Bartel. Sponsored by Amedisys Home Healthcare, caring for your loved ones as we would our own.